Yeah, actually, it was, you know, when you're elderly, your oral health is jeopardized due to the fact that you lose your ability to clean your mouth properly, and you take a lot of different drugs that one by one might not be serogenic, but taken together they are really decreasing your saliva flow. And this actually contributes to an imbalance in the oral cavity, and bacteria are stressed, and sometimes also the yeasts are growing, and if you have an overgrowth of yeast you have candidosis, which is a kind of painful condition. And so therefore our basic or background thinking was to, can we affect this imbalance by adding probiotic bacteria? So we selected roughly a little bit more than 200 frail elderly living in nursery homes, and they were enrolled, and they were randomized to either treatment with Lactobacillus reuteri tablets or placebo tablets, and they had this intervention for 12 weeks, if I remember right, yeah. And then the endpoint was the load or colonization of Candida albicans, which is the most prevalent yeast bug in the oral cavity. And they were balanced at baseline, and when we counted the results after 12 weeks, there was a significant reduction in the prevalence of high Candida counts. The reduction was 50%, so it was really significant in the control group, in the test group, and there was no change at all in the control group. So this study actually was quite convincing because it was double-blind, it was made according to the best scientific standards, so the results are very valid, and they showed that you could reduce the load of Candida albicans in those patients, and at the end of the day, of course, this will lower the risk for them to develop candidosis. Yeah, because this is not really my cup of tea, the elderly, because I'm from the beginning I'm a pediatric dentist, so therefore I think that one of the most promising concepts is the early intervention, because we know that the biofilm is formed and the biofilm is developed when you, of course, are very young, the first years of your life, and the timing and the sequence to which you are exposed to different bacteria will determine your profile. And therefore, I think it's a great potential that we actually can affect and expose kids to the beneficial bacteria early in life, because that will be helpful to early introduce a diversity, and also to stimulate and develop the immune response, because this is important not only for the dental chronic diseases, but of course also for other medical chronic conditions like asthma and eczema, allergies, diabetes. So I think this is really important, and I also think that it is good that we have, according to the common risk factor approach, that we actually can merge the efforts made by the dental professional, the medical profession, pediatricians, that what we do early in life can benefit not only dental or oral health, but also the general health and well-being.